All right, so let's clear things up right away. BATWatch is not a referral. When you think of BATWatch, don't think of specialist. We're not a neurology group. We're your preventative partner in care. We specifically focus on brain health. Think of us like a cognitive command center who provides long-term tracking and biomarker-driven insights for you and your patients. We provide ongoing updates. You remain in control. We don't replace you. We support you. We provide the tools for you and your patients to stay ahead of Alzheimer's risk. And it works fairly simply, just like sending somebody to Quest Labs for blood work or Cologuard for colon cancer screening. If you identify a patient that falls into an average or elevated risk criteria, you can place the order directly, just like any other lab panel, or simply send the patient to us and we'll take it from there. Just like you'd order a CBC or cholesterol panel, you can order online at batlevels.com or send us a fax. Once the order's in, we'll handle the rest. We contact the patient, we schedule testing, we'll handle the coordination, and we'll share everything back with you. BATWatch wasn't built around one test. It's a longitudinal system. Once testing begins, we monitor these BAT levels over time, so you can see if things are stable or changing, and if they're responding to any intervention, if that's the route we go. And because we are centralized, everything is consistent. Same protocols, same follow-ups, same reporting cadence delivered right back to you. And yes, we know sometimes testing can be a process, and we'd love to do everything in one shot. But we all know how insurance works. And because we want to ensure that insurance covers things, we have to protect them from unnecessary cost. And we do follow a phased testing model. For example, if an initial screening comes back as elevated, we may repeat the test before moving forward. Everything we do is designed to balance clinical clarity, patient cost, and medical necessity. This isn't shotgun testing. It's structured, data-driven care delivered step by step. There's no new portals to worry about, there's no training required, and there's no disruption in your day-to-day clinic practice that you need to worry about, and we're built to scale. And we're already helping providers nationwide to track, to treat, and to monitor brain health like never before. Knowledge is power. Keep watching more.